Are you a physical therapist wanting to understand your role in community health promotion? Well, in this video, we have an accomplished physical therapist that's going to shed some light on this subject coming up. Hi guys, Salone here with Expand Excel Physical Therapy and Community Health, helping you expand your education and excel in physical therapy and related professions. On this channel, we interview students and practitioners offering tools, tips, and resources, which can be found in the description area. And hey, if you're new here, consider subscribing and spreading the word. But in this video, I'm with Russ Certo, and he's going to give us some ideas on the role of physical therapists in community health. So, Mr. Sarto, can you start by just giving us a little brief introduction of who you are and what you do?
All right, I'm a physical therapist, been a physical therapist for 35 years, about 15 years ago. So I was in private practice 30 years ago, and 15 years ago decided that physical therapists should be involved in chronic disease management as well, in helping primary care doctors.
Yes.
Treat those patients and give them an exercise opportunity that they wouldn't get anywhere else, because they're not going to go to a general gym or general fitness industry kind of club. So we thought if we offered those services, the physicians who already are sending us patients would send us those kinds of patients beyond just musculoskeletal patients.
Yeah.
And we could help those people be introduced into the world of exercise and then help manage their chronic disease that way. And that turned into, how do you expand that, and what are the other opportunities in the community to get these people into the right place by the right provider at the right time. So,
Right.
So that's what we did 15 years ago, when we've kind of grown it out of that into something a whole lot bigger in our community.
Awesome. Well, can you help the viewers and I understand what community health means versus just health in general?
Well, sure. The example of the chronic disease patient is the perfect example, in that let's use somebody with newly diagnosed diabetes or prediabetes, or you could do the same thing with a newly diagnosed Parkinson's patient. So typically they would, especially the Parkinson's patients, refer to PT. We do our regular PT Parkinson's program, but then what do they do beyond that when they no longer qualify for physical therapy? You know, the Big and Loud program, those kinds of things that are out there. They're 8-week programs, but what's next for that guy or that woman who's got Parkinson's? So what we've been able to do is create a program for Parkinson's patients that would now be performed in what would look to you and anybody else walking in as a typical fitness club, but our approach to it is totally different. It's really about their health. And one of the things that you would do in terms of the community aspect is you would connect that patient to the Parkinson's Association, so that they would then be able to get all the benefits of the Parkinson's Association. If it's a diabetes patient, it's making sure that they get to a dietitian, so they get the nutrition, the appropriate nutrition conversation. I, as a therapist, you as a therapist, you could have that conversation about nutrition, stop eating Oreos, you know, that kind of thing. But for a diabetic, it's pretty specific, and they should see a dietitian. So one of our roles in the community health aspect as a physical therapist, in my belief, is we should be the ones connecting the patients that we're spending an hour 3 times a week with to the appropriate person in the community beyond their primary care doctor and beyond our services that are out there in the community that not everybody knows how to access. So that's the role that we think we should be playing.
So we should have a network of physicians that we can call on or refer our patients to at any time, depending on what their other health-related needs are.
Right, but it's beyond just the physicians, because patients know that they need to see physicians. So it's, in the diabetes example, they see their primary care doc. He may not want to manage it. He may want them to come to us for the exercise component and then go see an endocrinologist. We want to be sure that the other things in the community that are out there, support groups, the Diabetes Association, the things that they might offer. So back to the Parkinson's example, some states have the provision in their Parkinson's Association where they would give a Parkinson's patient $500 a year to access ancillary services. So what we've been able to do is tap into that $500 to help pay for a membership in the fitness club.
Amazing.
So there's things like that in every community. You need to go as a therapist, spend some time, learn what's out there, and learn what that can do for the patients you're being referred by your physician groups.
Yes, sir. Yes, sir. So what can I do as a physical therapist to educate myself on community health programs and maybe offer my patients, I think you hit on that a little bit, maybe offer my patients more resources outside of
Right,
what I do.
and I'll just kind of repeat that is, get outside of your office.
Yes.
Get out beyond the doctor and that relationship between you and the doctor. Instead of being, I don't want to say subservient, but I'm going to use the word subservient to the physician and being the guy only getting the referral at the bottom of the chain, be the proactive person in the medical community to go out, find out what's in the communities, find out the kind of patients you're passionate about. It might only be orthopedic cases, but you might find that for whatever reason, you're passionate about cancer patients. Your mother might have had breast cancer, therefore you are now kind of passionate about treating cancer patients.
Yes.
So go talk to the people who are cancer support groups. What needs do they have that you can now provide to them in terms of sending them your cancer patients, being a speaker at their support group, helping those breast cancer ladies get an exercise fitness program beyond the traditional PT stuff for their lymphedemas and the range of motion and strengthening things. You find out what it is you're passionate about as a therapist, get into the community, find out what services are out there that not a lot of people are accessing, and then you be the conduit to get those people that you're serving in your community to those appropriate places.
Perfect. Thank you so much, sir. And question of the day, guys. How are you promoting community health as a physical therapist? Connect with us in the comment section where, hey, some of the best conversations are happening. So engage, become a part of the Expand Excel community. Thanks for watching. Don't forget to subscribe and like this video. And remember, all show notes and links to tools, tips, and resources shared are in the description area. So check that out, and I'll see you in the next video. All right, stop. Physical therapist role in community health. Real big. Your role in community health? All right. Are you a physical therapist wanting to understand your role in community health promotion?